I'll just go ahead and get started. Welcome. So the title of my talk today is the Digital On-Ramp for Health. I'm the Director of Research and Operations at the Center for Body Computing. We're based out of the University of Southern California. We're a digital health research and innovation center, which essentially means that we focus on digital technology solutions that are geared towards health. So that could be anything ranging from wearables like the Fitbit or the Apple Watch to smartphone mobile applications that help you track medications in your prescriptions. So pretty wide array of technologies. So our vision at the center is to see a world in the not too distant future where technology solves the limitations of the current healthcare experience and transforms healthcare into what we call life care, which is a technology-driven, available anytime, anywhere services platform for health. So our mission at the center is to help modernize healthcare through technology to make it more affordable and accessible to all. And if there's anything in this world that should be easily accessible and deeply personal to everybody, it's healthcare. So the center was founded 12 years ago by my boss, Leslie Saxon. She's a cardiologist at USC Keck. She began implanting cardiac devices into her patients' hearts that became capable of wireless transmission over the years. So suddenly she was able to review the data from her patients' implanted heart devices without having to be in the same room as them. So this was really the beginning of this field that we call digital health. And she became really interested in this and wanted to do more research in it, so she founded the center. And she wanted to do more research in digital health, but not just that, but she wanted to explore the issues around, all of the issues that would emerge around these new devices. So the research at the center began with these implantable cardiac devices, but we've expanded the technologies that we're interested in to include wearables, smartphone applications, and more immersive technologies such as virtual reality and augmented reality. So we do research in all of these technologies. The center was the first to hold an academic conference in digital health. This year was our 12th year. We just had it last week, and the conference is a really good time for us to kind of review the state of digital health, how it's progressed really over the 12 years, but specifically over the previous year. It's a good time for us to, we present our research results, things that we've done in the past year, as well as bringing all the groups that we work with together to explore the issues that we're interested in digital health. We also we're the first to found a digital health fellowship. This is for physicians, it could be residents, those doing their fellowships, it could be grad students who want to take a year off and do research in digital health. We welcome them to apply, and we take one every year. And as I mentioned, we're not just interested in doing the research, but we're interested in the issues that arise around these technologies. So we're interested in policy and legislation and regulation of these to ensure that they're safe and effective. So we work really closely with groups such as the FDA to make sure that all of these emerging technologies are up to par with all the other standards that healthcare has been held to up to this point. So at the center, what we do really falls into three buckets. We do clinical research, policy and legislation, and technology development. And the future of healthcare. So this exploration of digital health, as I mentioned, started with implantable cardiac devices, but it's really expanded to include wearables and smartphone applications and a lot of other sensors that we interact with on a daily basis. All of these technologies have really streamlined and improved our lives, and we see the same thing happening for regulated healthcare. We just think that it's going to take a little bit more work and time to really be able to integrate the more traditional sources of data, such as from medical records, into the personally collected data that we're pulling off of wearables and smartphone apps. It's going to take a while to integrate those with each other, and then, as well as integrating them into the environments where we spend the most time. So that could be home, in our car, in a plane, in our offices. It's going to take a while to pull it all together. And then also to make sure, as I mentioned, that it's as safe and effective as all other healthcare is in the US. So that's really what we do at the center. We partner with collaborators to test digital health solutions, as well as to brainstorm on product development. So once we have a product and we're interested in researching how well it works for some patient population, we also want to ask the question of, was the way that the product was developed or the way that it was designed, is that the best way to get the most use out of it? Did it get us the outcomes we wanted? Did it improve healthcare? Did the users engage with it? Did they enjoy using it? Those kinds of things. So I'm just going to give an overview of a few of the research studies that we've done in recent years to give a better idea of what we do. So this one was, we partnered with VSP. They're one of the largest eye insurers in America. They have 90 million subscribers. The question that VSP was interested in answering is, they were thinking of a Fitbit is something you have to, you're not necessarily already wearing it, right? It's something you have to add to your wardrobe. So they thought our population base, they're already wearing prescriptive eyewear. So what if the activity tracker that you're interested in that's in the Fitbit was in your eyewear? Would that help adherence? Because a lot of these, I'm sure as you're all familiar, these activity trackers just end up in the back of your sock drawer after a while. They're novel and interesting and fun for a few months, but data shows that after 3 months, and then especially after 6 months, the usage just declines. People stop using them. So VSP was interested in if it was built into something you're wearing every day that you need to be wearing, would adherence improve? And if you had an app that went along with the product that, just like Fitbit, it shows your steps, it lets you connect with your friends, it kind of has this really integrated experience, would that help with adherence as well? So we worked with VSP to design these eyeglasses. They're very stylish, if I do say so myself. You could plug them and charge them. It came with an app that accompanied it. You could connect with your friends, share your steps, and we also had a charity component to the app. So you could build up your steps. You could, after you reach a certain amount, you could donate the money percentage, whatever you had earned, to a charity of your choosing. So we did this study in 300 subjects at USC. They were all employees of USC. Some of them were friends, so they were excited to connect with each other on the app. But unfortunately, we found that even if they had to wear their eyeglasses, after 3 months of usage, we did see a decline in steps and in usage of the eyeglasses, which was interesting. So that hypothesis was disproven. But we also found that the one aspect that we had added to the app, which was the social connectedness aspect, that would predict if they would use the glasses longer and if we saw an increase in steps. So the fact that they could connect with their friends and share and compete, that seemed to keep them engaged in the app longer and wearing the glasses. So that was really important to, I mean, it's just an activity investigation, but you can imagine if this was a more serious assessment for healthcare, you want the patient to if it's important for their health, you want to keep them engaged. So this was an important finding. One thing that seems to be predictive is social intervention. Another one of our recent studies, we did this in partnership with United Healthcare, AARP Foundation, and with Lyft, the ride-sharing service. So AARP Foundation and United Healthcare were really interested in transportation as a barrier to healthcare, right? Transportation is a huge barrier, even for you or I. Parking is an issue. I live in LA, traffic's horrible. But for seniors, you can imagine that it's even worse because many of them are not driving. They have to ask friends and family for a ride. It can be, and if they have chronic conditions that requires them to go to the medical center a lot, it can be a really huge burden to them and their family. So the question we wanted to ask was, what if you could lift this, no pun intended, if you could lift this barrier of transportation for this special population, would it decrease the missed clinic appointments? Would they make their appointments? Would they get to their pharmacy visits? And then we wanted to ask, healthcare is not just about visits to the doctor or to the medical center. It's really everything. It's going to the grocery store, physical therapy, gym, church, visiting your friends and family. So we wanted to expand it and let them take the Lyft rides anywhere and use it for anything and see, does that just increase their overall activity? Does it get them out of the house more? Are they seeing their friends and family more? So we did that. So we offered this for 150 patients at USC Keck that had seniors who had chronic conditions. We offered them 3 months of unlimited, unrestricted, free Lyft rides to use for whatever they wanted. They could go anywhere. We baselined them for 2 weeks. They didn't have the rides for the 2 weeks. They just had to keep a log of where they were going and what they were doing. And then we also gave them Fitbits. And the Fitbits, we weren't sure if they would be adopted by the population and if it would be a good metric for activity, but we thought we'd just give it a try and thought if they are getting out and being more active, they're getting in the lift, they're going to church more, they're going to visit their family more, would you see that reflected in their steps? The other thing we did is we recognized that, as I'm sure anybody in this room who's tried to teach their parents how to use any kind of app, we were aware that it was, it could have been difficult. So we spent a lot of time creating this curriculum and really teaching them how to use the app, a very simple, step-by-step guide with fun pictures. And then on top of that, at the beginning of the sign-up session for the study, we spent 1 to 2 hours going through, downloading the app with them, going over it with them. And in addition, our research coordinator was available to them at any time during the study that they wanted to call. If they had any technical issue, they would call and they could get some help on how to use it. And we didn't only help them on the technological aspect, we also explained Lyft to them, right? Because part of, in our pre-study survey, we found a lot of them were worried about, are the drivers safe? How do I pay them? So it's really basic things like they're vetted, it's insured, the cars have been checked, all those kinds of things around the service we spent a lot of time explaining to them. So the good news is that, so the study's ongoing, I'm not going to present final results, but the good news is that the seniors enthusiastically adopted the new technology. They also had the option to call in if they really didn't want to use the smartphone app for some reason. They didn't have to, they could call in and order a ride. But we found that over 80% of them, after the training, they loved the app, they wanted to use it, and they adopted it. And they honestly didn't call in with issues too frequently. So it was pretty easy to use. So we proved that if you spend a good amount of time in the beginning designing really quality content and explaining things to them and showing them how it can improve their lives, then they were eager, they're eager to adopt it. By the end of the study, they reported that it did significantly improve their daily living and it did increase their activity. So we're still analyzing the data, but just from preliminary results, it seemed like they did get out more. They were getting to their appointments more. They were visiting friends and family more. They were just getting out more, which is awesome and what we wanted to see. So this marine study is it's more about human performance, but we see human performance and health as very closely related. So this group is a very elite marine group we're working with at Camp Pendleton, and they have a really intense 25-day training that the students enter and then they either pass or they fail. So I'm bringing it up because the Marines are interested in what are the factors of a human that help predict whether someone will pass or fail this training. And we're interested in physical, mental, whatever it is that could help them pass. So we came in to do a study with them. We gave the Marines Apple Watches to wear day in and day out, so we're getting 24 hours of continuous biometrics, a heart rate, while they do the training and while they sleep and recover. And we also wanted to quantify their stable personal characteristics. We gave them personality surveys just to kind of see where they're at, how they approach life, how much anxiety they have, if they have personal positive or negative affect, those kinds of things. And then we also wanted to check in with them daily, so to get kind of a psychological snapshot of how much pain are you in, how do you feel like you'll graduate, do you feel like you got enough food and water, et cetera. So we're getting a daily snapshot, looking at stable personality traits, and then also looking at physical metrics. And all of this we're going to throw in a model, again this is ongoing research, to see if we can predict who will pass or who will fail. So the reason I mention it is because just the underlying, human performance is not hugely applicable, but the concept behind it is. So taking all these different dimensions, putting them into a model and seeing if you can predict human performance or health, that's super important. And things that we probably want to look at, not even in the marine study, but in future studies, in addition to physical and mental assessments, is lifestyle, environment, social connectedness, which as we saw in the other study is very important. So our collaboration with the WITH Foundation is what brings me here today. That was an overview of some of the research that we've done, but we don't only do research, we do other fun events. So the WITH Foundation, their mission is to promote the establishment of comprehensive health care for adults with developmental disabilities that's designed to address their unique and fundamental needs. So with the WITH Foundation, we aim to address the health challenges that are faced by people with disabilities and how specific technology products or services could provide support for these issues. So we've done multiple things with WITH, but today the thing I'm going to present on and discuss is the hackathon that we just held in July. So the challenge was to develop a skill for a voice assistant technology that addresses a healthcare issue for individuals with developmental disabilities and or seniors. And the reason that we chose voice assistant technology is because it's really taken off. It's exploded in recent years. 30 million American homes have them. They're very popular holiday gifts. Everyone has one. And also the technology is really advanced. So the accuracy of word recognition in them has really taken off. And the skills have really expanded. So the capabilities have exploded. They're much more capable than they were before, although they're still not to where we'd like them to be. The other issue of the challenge, so it's just the current US healthcare system is not designed currently to adequately consider the needs of individuals with developmental disabilities or seniors or many, many other groups, which causes a lot of disparities in healthcare. So we believe that emerging digital technologies can start to help bridge the gap and work toward inclusive healthcare for all. And so similar to the Americans with Disabilities Act, which was passed by Congress in 1990, that was the nation's first comprehensive civil rights law, addressing the needs of people with disabilities, prohibiting discrimination in employment, public services, public accommodations, etc. It was one of the first landmark legislations that really started to level the playing field. And we feel that digital technologies that we're beginning to see, whether it's wearables or apps or voice assistant technologies, we prove that they're safe and effective, we feel like they can be just as effective as a landmark legislation like this, as well as evening the playing field. There's many, many issues. I could never get into all of them where the healthcare system can be improved, but just as a few examples, people have different healthcare needs and they have different styles of communication, and there's really no good way of addressing this gap in styles of communication and differences in needs with your healthcare provider. It's a huge challenge. There's also a lack of appreciation for the need to preserve autonomy in healthcare decision making. Your doctor has usually, on average, I think, 13 minutes with you before they move on to another patient, and there's not a lot of time to build that kind of relationship. So for the hackathon, we left it kind of broad and open and wanted the teams to be really creative. We had about 28 to 30 applicants, and we chose 5 teams that we thought had really creative solutions. They came in, they had a 24 hackathon, they stayed overnight. We had a group of mentors come in to help advise them. Some of them were actual startups, some of them were students or postdocs at USC. And they all had different skill sets, but we wanted to fill in the gaps for their skill sets. So we had representatives from the medical community, we had physicians, we had medical students come in, represent the clinical side. We actually had representatives from Google and Amazon from their voice assistant groups and their cloud computing services come and help offer support for the teams. Of course, we had other computer science and AI experts there to help the developers as they were developing the solutions. And really importantly, we had storytellers, which we think is a huge thing with user engagement in these technologies. If your technology or solution is not engaging and the patient doesn't want to use it, then it doesn't matter how amazing the AI is, it's going to be useless. So we think storytelling is really important, and we partnered with USC Cinematic Arts to bring in storytellers. The technology is Amazon Echoes, Amazon Echo Shows, and then the Google Voice Kit, which is the same technology as Google Home, but it's the developer version. And just briefly some of the solutions. So Team Medi was one that they used natural language processing it was basically a medication adherence interactive solution on, I think it was the Amazon Echo. So it was kind of a fun way to make sure, to check in to see if you're taking your medications, to track that you're taking the right ones on the right days, and it was pretty interesting. Safe Food was a nutrition-based one. That was an interactive voice assistant. It was a beta version, and in the future, they plan to pull in patients' blood sugar levels, probably from like continuous glucose monitor, their medical history, their diet history, and to make it so that it can recommend food and make recommendations on things you should be eating and things you shouldn't be eating. I thought was a really fun one that was supposed to address social isolation. So it was a kind of little remote companion. I think it was set in an extraterrestrial world, and you had little extraterrestrial friends who over time would learn about you and your quirks and your social relationships, and then tie those things into the story and kind of just interact with you on a daily basis for companionship. But the winners were Team Amplify, and their solution was really amazing. It was for children with cerebral palsy. They used essentially therapy. So digital speech therapists, usually when they're, for their patients, they'll have exercises that they have to do at home. So to repeat certain sounds just to exercise their vocal cords. So they digitized this homework essentially that they have to do and made it into a really choose your own adventure, fun, interactive storytelling thing with the voice assistant. So it would start telling a story with trolls and forests and gems, and then the troll would tell you, oh, you've reached an impasse, you have to make this noise to pass, and then the child would make the noise, and then if the voice assistant would give feedback. So it would say something like, oh, try again, and the kid would have to keep trying, and then if they finally get it, say good job, and you would move on in the story. So it was an actual therapy that's used in real clinical care, and it was a really engaging solution, so they won. Lastly, I just want to do a plug with Foundation and one of our other collaborators, Sidebench Health. In November, they have a Universal Design Symposium and a beta day set up where they're bringing together designers and developers with individuals with developmental disabilities to provide real-time feedback as they're designing products and iterating in real time, which we also think is super important. So just a quick plug there, and I'll stop there. But lastly, I'll just say we were really, really proud of all the submissions we got in the hackathon, and we think that those technologies are just the beginning of what we can see, especially with voice assistant technologies. So we're excited with further development to see what other things we can create to bridge the gap in healthcare.